Hello. So I'm going to be taking the Clinical Documentation Improvement Practitioner exam. And currently I'm an RHIT, which is a Registered Health Information Technician. So I am just going to be studying, and I figured I would take you with me and we'll see how this goes. I thought maybe this would help me focus if I have a goal in mind to continue reading it for you guys. So let's okay. Clinical documentation improvement is a fast-growing career focused on improving physician documentation within healthcare to better reflect treatment provided, quality of care of the patient, improve accuracy of reimbursement, and display validity in statistical data for achieving goals in population health management, among other things. The Clinical Documentation Improvement Practitioner, CDIP, is the dedicated change agent in the CDI process. The CDIP works to maintain the integrity of the health record by working to maintain and improve quality health information. The purpose of this book is to provide practice exercises for the Certified Documentation Improvement Practitioner exam through a review of important ICD-10 CM and PCS and CPT coding material with clinical coding concepts, documentation improvement metrics, and leadership foundations. 2 simulations of the exam are included in this book to help improve test performance within the context of the 3-hour exam. The context of this book is not intended to predict what will be on the CDIP exam, and utilizing CDIP exam prep does not guarantee a passing score. However, CDIP exam prep does provide a focused method of preparing for the exam through review, practice, and exam simulation. Steps for success. Review AHIMA resources related to CDI. Review official guidelines for coding and reporting. Review anatomy and physiology, pathophysiology, medications, and labs as appropriate based on your strengths and weaknesses. Along with practice questions and case studies, this book contains 2 practice exams and follow up with references and other CDIP study resources. Essential job duties of the CDS, the Clinical Documentation Specialist. The Clinical Documentation Specialist is the job role most CDI practitioners hold. The CDS is responsible for having documentation clarified in the health record so that the facility can report accurate, complete, and timely data. Health record data should represent the resources utilized for patient care, aid in improving the quality of care, and ensure data is both clinically supported and clinically significant, which will in turn support appropriate reimbursement. Patient outcomes data will be more accurately reflected through reporting when clinical documentation practices are performed in a manner that facilitates coding to capture information describing patients' acuity, severity of illness, and risk of mortality. The CDI, Clinical Documentation Improvement Professional, can bring about these changes by consistently performing the essential duties of reviewer, educator, analyst, and collaborator. The CDS must also be congenial, engaging, and assertive to deliver in these roles. CDS duties. Reviewer. The CDS reviews health records daily to identify opportunities to clarify insufficient, contradictory, or inconsistent documentation. The CDS must be cognizant of changing guidelines, regulations, and advice for querying, coding, and documentation practices in order to perform these tasks compliantly. Review of data for trends in coding and diagnosis-related groups, DRGs. Assignments is needed as well as the annual coding and DRG updates to identify new query opportunities or to fine-tune existing queries. The CDS may also be charged with the review of retrospective DRG validation from third parties. The CDS duties. Educator. The CDS uses multiple mediums and avenues to deliver training and information to the provider and others within the institution. A major contribution to a successful CDI program is the ability to demonstrate the impact of the CDI program to a large percentage of the facility's staff. At a minimum, the CDS will provide education to clinicians through the querying process so they understand the impact of their documentation practices on quality reporting, accurate reporting of a patient's clinical information, and reimbursement. Provide ongoing education throughout the facility through presentations of data, examples of best practice documentation, and demonstration of the impact that documentation has on data reporting. identification and reporting of documentation practices on negative trends, collaborative development and reporting of quality measures including practitioner-specific data, education on clinical topics such as disease impact, drugs, and current medical practice, and the correlation to code assignment. CDS duties analyst. The CDS needs to understand data and be able to collate it into meaningful information. Data collected on a daily basis as part of their job task will promote understanding of program efficacy, the impact of documentation changes, and trends on the reporting of patient outcomes, as well as how these trends impact organizational efforts. The CDS must be able to review the data, looking for trends or patterns over time, as well as any variances that require further investigation. DRG shifts are reflected in the documentation of comorbid conditions and complications that could move a diagnosis into a higher-paying DRG. CDI programs must be constantly vigilant in tracking and trending program data to be aware of these payment patterns. The CDS duties collaborator. The CDS must be able to collaborate with clinicians and ancillary staff across the institution, including medical staff and leadership, executives, administrators, coding, and other support departments. A CDI program can only provide meaningful and sustained change when the CDS is able to work cooperatively to identify and solve difficult documentation issues. Clinicians who are working on reducing hospital-acquired conditions, HACs, patient safety indicators, PSIs, and other quality measures will be more effective in creating change when they understand the dynamics of documentation and how it impacts code selection and, ultimately, the facility's performance measures. Collaboration with the coding staff is critical as the exchange of clinical and coding knowledge and information will result in the most appropriate documentation that presents a true clinical picture of the patient's conditions and treatments during the hospitalization. I like how their source is themselves. CDI challenges. The following contains areas that are challenging from a CDI and code capture DRG assignment perspective. A thorough knowledge of disease process, clinical information, testing required for diagnosis and treatment, pharmacology, and services performed is essential for CDI exam success. Because national coding guidelines and references are used for the CDI exam, evaluate your hospital guidelines to identify any difference between the two. Be sure to code according to national guidelines. Recent issues addressed in Coding Clinic and CPT Assistant are important. Begin your review from the most recent to the oldest issues. Identify areas that are confusing or have been revised over time. Make sure you understand the most recent decisions regarding any particular coding issue. Knowledge of MSDRGs and APCs are important. Which MSDRG will be affected by major comorbidities or complications, MCCs, and complications or comorbidities, CCs, is key information. You should have a general idea about common MSDRGs for the average hospital in the United States and the reimbursement methodology of APCs. For example, what status indicators mean and how to assign evaluation and management levels if given a template. On the CDI exam, questions related to MSDRG hierarchy and diagnosis and procedure impact will be utilized to test knowledge and understanding of MSDRG structure and impact of diagnosis and procedures in DRG shifts. The current audit climate involves many different audit contractors and audit focus areas. Knowledge of current audit contractors such as Centers for Medicare and Medicaid Services, recovery audit contractors will be beneficial. An understanding of accurate principal diagnosis assignment is key. It is essential to know the disease process that underlie ethical coding. Much of this knowledge is based in Coding Clinic reference material and the Uniform Hospital Discharge Dataset, UHDDS. Generally, cases on the exam reflect common cases that a coder in an average hospital would code. Determine if you have a knowledge deficit in any common coding areas because your facility does not treat that type of patient. For example, some facilities do not provide services for newborns, deliveries, heart catheterizations, coronary artery bypass grafts, CABGs, or neonatal intensive care. If you work in such a facility, you will need to strategize how to gather expertise in these areas. One way to gain expertise is to review the coding exercises in a basic coding book and to use an encoder to determine the MSDRGs associated with the exercises. On the CDI exam, national coding principles are emphasized. Reviewing of the last 2 years of the Journal of AHIMA is a worthwhile endeavor. Be mindful of such topics as future nomenclatures such as ICD-11 and the Health Insurance Portability and Accountability Act, HIPAA. Also keep in mind that sometimes CDS can get into habits that may subtly deviate from coding guidelines. Be on alert and identify any of these habits in order to correct them. Key considerations in CDI. Note signs and symptoms of a condition. Utilize clinical indicators to support the condition/diagnosis within the health record. Identify treatment of the condition to include diagnostic testing, procedures/treatments, and medications. Understand when the need to query is required. Coding guidelines. Inpatient. Inpatient coding guidelines are a fundamental part of what is required to report diagnoses and procedures appropriately, especially with the implementation of ICD-10. Not only are they important for the coder, but also for the clinical documentation improvement specialist. Review and know the coding guidelines as appropriate for exam success and success in your role as a CDS. Outpatient. Outpatient CDI is steadily becoming a focus with providers as we move through the shift from volume to value with the various quality initiatives on the horizon. The official coding guidelines do offer guidance on coding requirements for outpatient settings. Outpatient settings include physician offices or clinics, emergency departments, outpatient surgery, and observation units. Review the guidelines and be aware of the impact and setting where applicable. Principal diagnosis. The assignment of the principal diagnosis allows for the encounter to be placed in the appropriate MSDRG. The principal diagnosis is defined as the condition established after study to be chiefly responsible of occasioning a patient to the hospital. Proper selection of the principal can ensure a facility is capturing the services required for the pay, visit, and compliance risk. Understanding if the patient had the condition on presentation to the facility, whether through the emergency department, outpatient surgery, observation, or direct admission, is a key decision maker in selecting the principal. In the outpatient area, the principal diagnosis is called the first listed diagnosis. At times within the outpatient setting, a first listed diagnosis may be a sign or symptom, as the definitive diagnosis has not yet been fully established. Secondary diagnoses. Secondary diagnoses are many times chronic conditions that impact a patient's conditions. These chronic conditions are being addressed and treated with maintenance therapy or some other type of active treatment. Secondary diagnoses could also be acute conditions that may be present at the time of admission, but not the focus of treatment to assign as the principal diagnosis. Complications or comorbidities are also secondary diagnoses that impact severity, quality, and length of stay. UHDDS states that reporting of other diagnoses for acute care, short-term, long-term care, and psychiatric hospitals, home health agencies, rehab facilities, nursing homes, etc. are defined by diagnoses requiring clinical evaluation or therapeutic treatment, or diagnostic procedures or extended length of hospital stay, or increased nursing care and or monitoring. Within the outpatient setting, secondary diagnoses are sometimes signs and symptoms of a condition, and conditions that are questionable, possible, and probable should not be reported. Principal procedure. The principal procedure is in most cases that which is most closely related to the principal diagnosis. Present on admission indicator. The present on admission indicator has been beneficial in assisting provider awareness in reducing or eliminating infections, injuries to patients, and improving quality care. Providers utilize this indicator on all patient diagnoses to identify whether a condition was present on admission, not present on admission, clinically undetermined, or unknown. The Centers for Medicare and Medicaid Services have created a list of diagnoses called hospital-acquired conditions that, if not present on admission, have adverse quality impact and negative financial implications. Providers utilize the POA indicator to inform CMS and other agencies on whether the condition was hospital-acquired or not. CPT. CPT is published and maintained by the American Medical Association. See the CPT manual for instruction on CPT codes. Honestly, reading through this, it's basically saying, look at all these other things that you should be using to study. I'm going to list them here, and you shouldn't have bought this. It was $85. But we'll continue. Health record documentation and clinical indicators. Reviewing and understanding the health record, whether in the electronic or paper format, is essential for the CDS. The premise behind the submission of coded data and CDS review is that it is based solely on physician documentation and clinically supported within the record. This documentation can be primarily found within emergency department reports and notes, history and physical, consultations, operative reports, discharge reports, and progress notes. This list is not all-inclusive, but the CDS should keep in mind physician documentation is the driver of the process and utilize other key components of the health record to assist, such as labs, radiology, meds, i.e. clinical indicators. Clinical indicators provide evidence supporting the patient's diagnosis via lab testing, radiology, examination, medication therapy, and treatments. Performing validation of diagnoses clinically can assist the CDS in daily chart review, the query process, and defense for codes signed. So at this point, we've gone through some of the basic things that we are going to be considering. And the next large portion is about MS-DRG structures and metrics and statistics. I am going to be studying this book many times over. So I think another time I will possibly do the video on MS-DRG structure if this is something you guys would like to see. So I will see you in another video. Bye.